Hello everyone, now let us discuss about 2023 CPT coding guidelines for surgery urinary system part 1. In the current session, we will be discussing the CPTs in the range 50010 to 50593. So first of all, coming to kidney. Kidney is again categorized into various topics. They are incision, excision, renal transplantation, introduction, repair, laparoscopy, endoscopy, and finally other procedures. The CPT range for incision is 50010 to 50135, whereas excision comes under the range 50200 to 50290, and renal transplantation CPTs come under the range 50,300 50300 to 50380, and introduction it is in the range 50382 to 50435. Coming to repair, they come under 50400 to 50540, and coming to laparoscopy, they are 50541 to 50549, and endoscopy CPTs are in the range 50551 to 50580, and finally other procedures, they come under 50590 to 50593. Now let us discuss about incision. Nephrolithotomy is the surgical removal of stones from the kidney, whereas pylorlithotomy is the surgical removal of stones from the renal pelvis. And this section of guidelines refers to the removal of stones from the kidney or renal pelvis using a percutaneous antegrade approach. Whereas breaking and removal of stones is separate from accessing the kidneys, or accessing the kidney with dilation of the tract to accommodate an endoscope used in an endourological procedure, or dilation of a previously established tract to accommodate an endoscope used in an endourologic procedure. These procedures include antegrade removal of stones in the calyces, renal pelvis and or ureter with the antegrade placement of catheters, stents and tubes, but do not include retrograde placement of catheters, stents or tubes. And the code 50080 describes nephrolithotomy or pylolithotomy using a percutaneous antegrade approach with endoscopic instruments to break and remove kidney stones of 2 centimeters or smaller. Whereas the code 50081 includes the elements of 50080, but it is reported for the stones larger than 2 centimeters. Branching, stones in multiple locations, urethral stones, or in patients with complicated anatomy. In all these cases, you need to code 50081. And creation of percutaneous axis or dilation of the tract to accommodate a large endoscopic instruments used in the stone removal, which are given by the CPTs 50436 and 437, is not included. The dilation of the tract is not included in 50080 and 81 and may be reported separately if performed. And the codes 50080 and 81 include placement of any stents or drainage catheters that remain indwelling after the procedure. And report 1 unit of either 50080 or 50081 per side, that is per kidney, regardless of the number of stones broken and or removed or location of the stones. This is important. Report 1 unit of 50080 or 50081 per kidney or per side, regardless of the number of stones broken or removed or location of the stones. For bilateral procedure, report 50080 and 50081 with 50 modifier. And when 50080 is performed on one side and 50081 is performed on the contralateral side, modifier 50 is not applicable. And the placement of additional accesses if needed into the kidney and removal of stones through other approaches, for example, open or retrograde, may be reported separately if performed. And for retroperitoneal exploration, abscess, tumor or cyst, you need to see 49010, 49060 or 492032 to 49205. Now coming to the CPTs. The first CPT is 50010. Renal exploration not necessitating other specific procedures. And for laparoscopic ablation of renal mass lesion, use 50542. The next is 50020. Drainage of perirenal or renal abscess open. And for percutaneous image guided fluid collection drainage by catheter of perirenal or renal abscess, you need to use 49405. The next CPT is 50040. Nephrostomy, nephrostomy or nephrotomy with drainage. The next is 50045. Nephrotomy with exploration. And for renal endoscopy performed in conjunction with this procedure, you need to refer 50570 or 50580. CPTs in the range 50570 to 50580. The next is 50060. Nephrolithotomy, removal of callus. The next is 50065. Nephrolithotomy, secondary surgical operation for callus. The next is 50070. Nephrolithotomy, complicated by congenital kidney abnormality. The next is 50075. Nephrolithotomy, removal of large staghorn callus filling renal pelvis and calluses, including anatrophic pyelolithotomy. Whenever nephrolithotomy is accompanied by removal of large staghorn callus, you need to report 50075. Next, coming to the CPT 50080 and 50081. Both the CPTs are revised, which are indicated by these triangles. So first of all, coming to 50080, percutaneous nephrolithotomy or pyelolithotomy, lithotripsy, stone extraction, antegrade urethrostomy, antegrade stent placement and nephrostomy tube placement when performed, including image guidance, simple. So all these things are included in this CPT. Nephrolithotomy or pyelolithotomy, lithotripsy, stone extraction, antegrade urethrostomy, antegrade stent placement and nephrostomy tube placement when performed, including image guidance, simple. The stone must be 2 centimeters in single location of kidney or renal pelvis, non-branching stones. And complex, whenever the procedure is complex, that is stone is greater than 2 centimeters, branching stones, stones in multiple locations, ureter stones and complicated anatomy. In all these cases, you need to report 50081. And as we have discussed earlier, 50080 and 81 may be reported once per side, and for bilateral procedure, you need to append 50 modifier. And do not report 50080 and 50081 in conjunction with 50430, 431, 50433, 434 and 50435 if performed on the same site. And for establishment of nephrostomy without nephrolithotripsy, nephrolithotomy, you need to see 50040, 50432, 433 and 52334. And for dilation of an existing percutaneous axis for an endourological procedure, you need to refer 50436. And for dilation of existing percutaneous axis for an endourological procedure with new axis into collecting system, you need to use 50437. And for additional new axes into kidney, you need to use 50437 for each new axis that is dilated for an endourologic procedure. And for removal of stone without lithotripsy, you need to use 50561. And for cystourethropy with insertion of urethral guide wire through kidney to establish a percutaneous nephrotomy retrograde, you need to use 52334. The next CPT is 50100. All these things are revised guidelines. That is why I am specifying here. Next CPT is 50100. Transection or repositioning of aberrant renal vessels. For transection or repositioning of aberrant renal vessels, you need to report 50100. The next is 50120. Pilotomy with exploration. And for renal endoscopy performed in conjunction to this procedure, you need to see 50570 and 580. The next is 50125. Pilotomy with exploration with drainage. Pilostomy. The next is 50130. Pilotomy with removal of callus. That is pilolithotomy, pelviolithotomy, including cogulum pilolithotomy. The next is 50135. Pilolithotomy complicated due to secondary operation, congenital kidney abnormality, etc. And for supply of anti-carcinogenic agents, use 90070 in addition to the code for primary procedure. Now let us see an example. Patient presents for a percutaneous pilolithotomy with dilated and basket extraction measuring 1 centimeter. Here the stone is 1 centimeter. So the CPT is 50080. Percutaneous nephrolithotomy or pilolithotomy, lithotripsy, stone extraction, antegrade urethroscopy, antegrade stent placement and nephrostomy tube placement when performed, including image guidance. Simple. That is the stone up to 2 centimeters in single location of kidney or renal pelvis, non-branching stone. Here our stone is 1 centimeter. So the CPT is 50080. Coming to excision CPTs. Before going into these CPTs, for excision of retroperitoneal tumor or cyst, you need to refer 49203 to 49205. And for laparoscopic ablation of renal mass lesion, you need to use 542. Here, the first excision CPT is 50200. Renal biopsy percutaneous by trocar or needle. And for radiological supervision and interpretation, you need to refer 76942 or 77002, 77012 and 77021. And for fine needle aspiration biopsy, you need to see these integumentary system codes. That is 10005, 0006, 0007, 0008, 0009, 10010, 10011 and 10012. And for evaluation of fine needle aspirate, you need to refer 88172 and 88173. The next CPT is 50205. Renal biopsy by surgical exposure of kidney. The next is 50220. Nephrectomy, including partial urethrectomy, any open approach, including rib resection. The next is 50225. Nephrectomy, complicated because of previous surgery on the same kidney. The next is 50230. Nephrectomy, radical with regional lymphadenectomy and or vena cava thrombectomy. And for vena cava resection with reconstruction is necessary, you need to use 37799. The next CPT is 50234. Nephrectomy with total urethrectomy. Previously it is partial urethrectomy. 50220. Now 50234 includes nephrectomy with total urethrectomy and bladder cuff through same incision. 50236 includes nephrectomy with total urethrectomy and bladder cuff through separate incision. The next CPT is 50240, nephrectomy partial. And for laparoscopic partial nephrectomy, you need to use 50543. The next is 50250, ablation open one or more renal mass lesion, cryosurgical, including intraoperative ultrasound guidance and monitoring if performed. And for laparoscopic ablation of renal mass lesions, you need to use 50542. And for percutaneous ablation of renal tumors, you need to refer 50592 and 593. The next is 50280, excision or unroofing of cyst of kidney. And for laparoscopic ablation of renal cyst, you need to refer 50541. The next is 50290, excision of perinephric cyst. Now let us see an example. Patient is a 68-year-old male admitted for left flank nephrectomy with partial urethrectomy. He has renal atrophy and chronic renal inflammation. The pathology reports reveal marked glomerular sclerosis, chronic inflammation of kidney, renal pelvis and urethra. So here the CPT is 50220. Nephrectomy including partial urethrectomy, any open approach including rib resection. Now coming to next topic, that is renal transplantation. Renal autotransplantation includes reimplantation of the autografts as the primary procedure along with secondary extracorporeal procedures, for example partial nephrectomy, nephrolithotomy reported with 51 modifier. And renal allotransplantation involves three distinct components of physician's work. The first one is cadaver donor nephrectomy, unilateral or bilateral, which includes harvesting the graft and cold preservation of the graft, perfusing with cold preservation solution and cold maintenance. For that you need to use 50300. Leaving donor nephrectomy, which includes harvesting the graft, cold preservation of the graft, perfusing with cold preservation solution and cold maintenance, and care of the donor. For that you need to see 50320 and 50547. The next is backbench work. Standard preparation of the cadaver donor renal allograft prior to transplantation, including dissection and removal of perinephritic fat, diaphragmatic or retroperitoneal attachments, excision of the adrenal gland and preparation of ureter, renal veins and renal artery, ligating the branches as necessary. Standard preparation of living donor renal allograft, that is open or laparoscopic prior to transplantation, including the dissection and removal of perinephric fat and preparation of ureter, renal veins and renal arteries, ligating branches as necessary. For cadaver you need to use 50323 and for living donor you need to use 50325. Additional reconstruction of cadaver or living donor renal allograft prior to transplantation may include venous, arterial and or urethral anastomosis necessary for implantation. The third step is recipient renal allotransplantation, which includes transplantation of the allograft with or without recipient nephrectomy and care of the recipient. And for dialysis, you need to refer 909352 to 90909. And for laparoscopic donor nephrectomy, you need to use 50547. And for laparoscopic drainage of lymphocyte for 2 peritoneal cavity, you need to use 49323. The first CPT is 50300. Donor nephrectomy, including cold preservation from cadaver donor, unilateral or bilateral. The next is 50230. Donor nephrectomy open from living donor. The next is 50323. Backbench standard preparation of cadaver donor renal allograft prior to transplantation, including dissection and removal of perinephric fat, diaphragmatic and retroperitoneal attachments, excision of adrenal gland, and preparation of ureter, renal pelvis and renal arteries, ligating branches as necessary. And do not report 50323 in conjunction with 60540 and 60545. The next is 50325. Backbench standard preparation. Previously it is cadaver, now it is living donor. Renal allograft. Rest of the things are same. Open or laparoscopic prior to transplantation, including the dissection and removal of perinephric fat and preparation of ureter, renal veins, renal artery, ligating branches as necessary. The next is 50327. Backbench restoration of cadaver or living donor renal allograft prior to transplantation, venous anastomosis each. And for arterial anastomosis each, you need to use 50328. And for urethral anastomosis each, you need to use 50329. The next CPT is 50340. Recipient nephrectomy. For bilateral procedure, you need to use 50340 with modifier 50. The next is 50360. Renal allotransplantation, implantation of graft without recipient nephrectomy. The next is 50365 with recipient nephrectomy. And for bilateral procedure, you need to report 50 modifier. The next CPT is 50370. Removal of transplanted renal allograft. The next is 50380. Renal autotransplantation, reimplantation of the kidney. And for renal autotransplantation, extracorporeal surgery, use autotransplantation as the primary procedure and report secondary procedures. For example, partial nephrectomy, nephrolithotomy with 51 modifier. Now coming to the next topic, that is introduction. Renal pelvis catheter procedures. The first one is indwelling, internally dwelling. The CPT is 50380. Removal via snare or capture and replacement of internally dwelling urethral stent via percutaneous approach, including radiological supervision and interpretation. And for bilateral procedure, use modifier 50. And for removal and replacement of internally dwelling urethral stent via transurethral approach. This is percutaneous approach. For transurethral approach, you need to use 50385. The next CPT is 50384. Removal via snare or capture of internally dwelling urethral stent via percutaneous approach, including radiological supervision and interpretation. And for bilateral procedure, you need to use 50 modifier. And do not report 382, 50382 and 384 in conjunction with 50436 and 50437. And for removal of internally dwelling urethral stent via transurethral approach, you need to use 50386. The next CPT is 50385. Removal and replacement of internally dwelling urethral stent via transurethral approach, without use of cystoscopy, including radiological supervision and interpretation. The next CPT is 50386. Removal of internally dwelling urethral stent via transurethral approach, without use of cystoscopy, including radiological supervision and interpretation. Next is externally accessible. Previously it is internally dwelling. Now externally accessible. The first CPT is 50387. Removal and replacement of externally accessible nephrourethral catheter. For example, external or internal stent requiring fluoroscopic guidance, including radiological supervision and interpretation. For bilateral procedure, you need to use 50 modifier. And for removal and replacement of externally accessible urethral stent via urethrotomy or ileal conduct, you need to use 50688. And for removal without replacement of externally accessible urethral stent not requiring fluoroscopic guidance, see E&M service codes. The next CPT is 50389. Removal of nephrotomy tube. Removal of nephrotomy tube requiring fluoroscopic guidance. For example, with concurrent indwelling urethral stent. And removal of nephrotomy tube not requiring fluoroscopic guidance is considered as inherent E&M service. Report the appropriate level of E&M. Only it is coded 50389 when fluoroscopic guidance is required. Now coming to other introduction, that is injection, change or removal procedures. Percutaneous genitourinary procedures are performed with imaging guidance, for example fluoroscopy or ultrasound. And diagnostic nephrostogram and or ureterogram are typically performed with percutaneous genitourinary procedures and are included in 50432, 435, 434, 50432, 33, 34, 35, 36, 37 and 50693, 694 and 50695. And the code 50436 describes enlargement of existing percutaneous tract to the renal collecting system to accommodate large instruments used in an endourologic procedure. And this includes predilating the urinary tract imaging, post-procedure nephrotomy tube placement when performed, and includes all radiological supervision and interpretation and imaging guidelines, for example ultrasound or fluoroscopy. The CPT 50436. And it may not be reported with 50432, 3334 for basic dilation of a percutaneous tract during initial placement of catheter or device. The next is code 50437. It includes all elements of 50436 but also includes new access into renal collecting system performed in the same session when a pre-existing tract is not present. Whenever a new access is performed, you need to report 50437. And the codes 50430 and 431 are diagnostic procedure codes that include injection of contrast material, all associated radiological supervision and interpretation, and procedural imaging guidance. And 50430 also includes accessing the collecting system and or associated ureter with a needle and or catheter. And they may not be reported together. 50430 and 431 should not be reported together. Not should, may not be reported together with 50432, 33, 34, 35, 693, 694 and 695. Codes 50432, 33, 34 and 35 represent therapeutic procedures describing catheter placement or exchange and include the elements of access, drainage, catheter manipulations and imaging guidance. For example, ultrasonography and or fluoroscopy as well as diagnostic imaging supervision interpretation when performed. And the code 50433 describes percutaneous nephrotomy with the additional accessing of the ureter or bladder to ultimately place a nephrourethral catheter, a single transnephric catheter with nephrotomy and urethral components that allow drainage internally, externally or both. And the codes 50430, 431, 432, 33, 34, 35, 606, 693, 694, 695, 705 and 706. The renal pelvis and its associated urethral, all the codes, they consider the renal pelvis and its associated ureter are considered a single entity for reporting purpose. While reporting the above mentioned codes, that is from 50430 to 50706, the renal pelvis and its associated ureter are considered a single entity for reporting purposes. And these above mentioned codes may be reported once per each renal collecting system or ureter accessed. For example, two separate codes would be reported for bilateral nephrotomy tube placement or for unilateral duplicated collecting system or ureter requiring two separate procedures. These codes may be reported once for each renal collecting system or ureter accessed. The next CPT is 50390, aspiration and or injection of renal cyst or pelvis by needle percutaneous. And for radiological supervision, you need to see 74425, 74470, 76942, 77002, 77012 and 77021. And for antegrade nephrostogram or antegrade pyelogram, you need to see 50430 and 41. The next CPT is 50391. Instillations of therapeutic agent into renal pelvis and or ureter through established nephrotomy, pyelostomy or urethrotomy tube. For example, anti-carcinogenic or antifungal agent. The next CPT is 50436. Dilation of existing tract percutaneous for an endourologic procedure including imaging guidance. For example, ultrasound and or fluoroscopy and all associated radiological supervision and interpretation with the post-procedure tube placement when performed. This is an out of numerical sequence code, hence it is indicated by this sign. The next is 50437. Dilation of existing tract including new access into renal collecting system. And do not report 50436 and 37 in conjunction with 50382, 384, 430, 431, 432, 433, 52334 and 74485. For nephrolithotomy, you need to refer 50080 to 50081. And for dilation of an existing percutaneous axis for an endourological procedure with a new axis into the collecting system, you need to use 50437. For additional new axis into the kidney, you need to use 50437 for each new axis that is dilated for an endourological procedure. And for endoscopic surgery, you need to see 50551 and 50551 to 50561. And for retrograde percutaneous nephrostomy, you need to see 52334. The next CPT is 50396. Manometric studies through nephrostomy or pyelostomy tube or indwelling urethral catheter. And for radiological supervision and interpretation, you need to use 74425. The next CPT is 50430. Injection procedure for antegrade nephrostogram and or uretrogram. Complete diagnostic procedure including imaging guidance. For example, ultrasound or fluoroscope and all associated radiological supervision and interpretation. New access. Injection procedure for antegrade nephrostogram or urethrogram. The next is 50431. Injection procedure for antegrade nephrostogram or uretrogram for existing axis. And do not report 50430 and 431 in conjunction with 432, 33, 34, 35, 693, 694, 695 and 74425 for the same renal collecting system and or associated ureter. The next CPT is 50432, placement of nephrostomy catheter. The placement of nephrostomy catheter percutaneous including diagnostic nephrostogram and or ureterogram when performed, imaging guidance, and all associated radiological supervision and interpretation. The next is 50433, placement of nephroureteral catheter, percutaneous, including diagnostic nephrostogram and or ureterogram when performed, imaging guidance and all associated radiological supervision and interpretation, new access. And as nephrostogram or ureterogram are included, diagnostic nephrostogram or ureterogram are included, you should not report 50433 or 432 in conjunction with 50430, 3132, 693, 694, etc. And for nephroureteral catheter removal and replacement, you need to use 50387. The next CPT is 50434. Convert nephrostomy catheter to nephroureteral catheter, percutaneous, including diagnostic nephrostogram and or ureterogram when performed, image guidance, and all associated radiological supervision and interpretation via pre-existing nephrotomy tract. The next CPT is 50435. Exchange nephrotomy catheter. Exchange nephrotomy catheter, percutaneous, including diagnostic nephrostogram or ureterogram when performed, image guidance, and all associated radiological supervision and interpretation. Now coming to repair CPTs, the first CPT is 50400. Pyeloplasty, Foley Y pyeloplasty, plastic operation on renal pelvis with or without plastic operation on ureter, nephropexy, ureterostomy, pylostomy, or urethral splinting, simple. Whenever pyeloplasty is complicated by congenital kidney abnormality, secondary pyeloplasty, or solitary kidney or calicoplasty, you need to refer or report 50405. And for laparoscopic approach, you need to use 50544. The next CPT is 50550. Nephrorrhaphy, suture of kidney wound or injury. For the suture of kidney wound or injury, you need to report 50550. The next is 50520. Closure of nephrocutaneous or pilocutaneous fistula. The next is 50525. Closure of nephrovisceral fistula. For example, renocolic, including visceral repair, abdominal approach. For the closure of nephrovisceral fistula by abdominal approach, you need to report 50525. And for thoracic approach, closure of nephrovisceral fistula, including visceral repair, thoracic approach, you need to report 50526. The next CPT is 50540. Symphysiostomy for horseshoe kidney with or without pyeloplasty and or other plastic procedures, unilateral or bilateral, one operation. Now let us see an example. Urologist is called into operating room to repair a kidney laceration status post motor vehicle accident. The urologist examines the kidney and repairs a small laceration of the kidney, 2 cm laceration of the kidney. Here the CPT is 50550. Nephrorrhaphy, suture of kidney, wound or injury. Now coming to laparoscopy. So, whenever we talk about laparoscopy, surgical laparoscopy always includes diagnostic laparoscopy. And to report a diagnostic laparoscopy, that is peritoneoscopy, you need to refer 49320. Coming to first CPT, that is 50541. Laparoscopy, surgical ablation of renal cysts. The next is 50542. Laparoscopy, surgical ablation of renal mass lesion, including intraoperative ultrasound guidance and monitoring when performed. And for open procedure, you need to see 50250. And for percutaneous ablation of renal tumors, you need to refer 50592 and 50593. The next CPT is laparoscopy surgical with partial nephrectomy. It is reported with 50543. And for open procedure, the CPT is 50240. The next is laparoscopy surgical with pyeloplasty. The CPT is 50544. The next is 50545. Laparoscopy surgical with radical nephrectomy, including removal of Girota's fascia and surrounding fatty tissue, removal of regional lymph nodes, and adrenalectomy. And for open procedure, you need to refer 50230. The next is laparoscopy surgical with nephrectomy, including partial urethrectomy. The CPT is 50546. The next CPT is 50547. Laparoscopy surgical with donor nephrectomy, including cold preservation from living donor. And for open procedure, you need to see 50320. And for backbench renal allograft standard preparation prior to transplantation, you need to use 50325. And for backbench renal allograft reconstruction prior to transplantation, you need to refer the CPTs 50327 and 329. The next is 50548. Laparoscopy surgical with nephrectomy with total urethrectomy. And for open procedure of nephrectomy with total urethrectomy, you need to see 50234 and 236. And finally, 50549 deals with unlisted laparoscopy procedure renal. Unlisted laparoscopy procedure renal. Now coming to CPTs for endoscopy. For supply of materials, you need to use 99070. The first CPT is 50551. Renal endoscopy with established nephrostomy or pylostomy with or without irrigation, installation of pylography exclusive of radiological service. Renal endoscopy through established nephrostomy or pylostomy with or without irrigation, installation or uretropylography exclusive of radiological services. The next CPT is 50553. Renal endoscopy through established nephrostomy with urethral catheterization with or without dilation of ureter. And for image guided dilation of ureter without endoscopic guidance, we need to use 50706. The next is 50555. Renal endoscopy with biopsy. And for image guided biopsy of ureter and or renal pelvis without endoscopic guidance, you need to use 50606. The next CPT is 50557. Endoscopy with fulguration and or incision with or without biopsy. The next is 50561. Endoscopy with removal of foreign body or callus. The next is 50562. Endoscopy with resection of tumor. And when procedures 50570 and 580 provide a significant identifiable service, they may be added to 50045 and 50120. The next CPT is 50570. Renal endoscopy through nephrotomy or pylotomy with or without irrigation, installation or uretropylography exclusive of radiological service. One important point to be considered whenever coding endoscopy is broadly divided into whether the procedure is performed through established nephrostomy or pylostomy or without established nephrostomy and pylostomy. Previously, up to 50562, we have discussed the renal endoscopy through established nephrostomy or pylostomy. And from 50570, we are discussing about renal endoscopy through nephrotomy or pilotomy. This is not established. Here they are again making a new nephrotomy or pilotomy. So the next CPT is 50572. That is nothing but renal endoscopy through nephrotomy or pilotomy with urethral catheterization with or without dilation of ureter. The next is 50574. Renal endoscopy through nephrotomy or pilotomy with biopsy. The next is 50575. Renal endoscopy through nephrotomy or pilotomy with endopilotomy, including cystoscopy, urethroscopy, dilation of ureter, urethral pelvic junction, incision of urethral pelvic junction, and insertion of endopilotomy stent. The next is 50576. Renal endoscopy through nephrotomy or pilotomy with fulguration and or incision with or without biopsy. The next is 50580. Renal endoscopy through nephrotomy or pilotomy with the removal of foreign body or callus. Now let us say an example. A patient comes in for removal of callus from renal pelvis via renal endoscopy. Removal of callus from renal pelvis via renal endoscopy through established nephrostomy. So the CPT here is 50561. Renal endoscopy through established nephrostomy or pilostomy with or without irrigation, installation, urethral pylorography exclusive of radiological service with the removal of foreign body or callus. Now coming to other procedures. The first CPT is 50590, lithotripsy extracorporeal shock wave. The next is 50592, ablation one or more renal tumors, percutaneous unilateral radiofrequency. And 50592 is a unilateral procedure. For bilateral procedure, you need to report 50592 with 50 modifier. And for image guidance and monitoring, you need to see 76940, 77013, 77022. The next CPT is 50593. Ablation, renal tumor, unilateral, percutaneous, cryotherapy. And 50593 is a unilateral procedure. For bilateral procedure, you need to append 50 modifier. And for imaging guidance or monitoring, you need to use 76940, 77013 and 77022. Now let us see an example. A patient has a 3.6 centimeter tumor in the lower pole of the right kidney. Percutaneous right renal cryosurgical ablation is performed. So here the CPT is 50593 along with RT modifier to indicate right side. Ablation renal tumor, unilateral, percutaneous, cryotherapy. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.